I did have some issues because sometimes even walking, after I stop for getting something, I feel kind of, my breath was kind of short. I decided to visit the doctor and they checked me out and they say you have to get a good exam and find out what's going on with your heart. Because what I see is not that very good.
My name is Dr. Abhimanyu Seni. I'm one of the interventional cardiologists at Cook County Hospital and Health Systems. With me, it's Dr. Savakit. He's the cardiothoracic surgeon. Mr. Flores, our patient, came to us with symptoms of shortness of breath. And on his initial examination and his echocardiogram, which is an ultrasound of the heart, we found that the main valve that connects the heart to the rest of the body, called the aortic valve, was severely diseased and tight. Whenever you have this, you tend to have symptoms of shortness of breath or chest discomfort, or any physical exertion makes you tired. And these were some of the symptoms that were picked up when Mr. Flores came to us. The treatment for these kind of problems are traditionally either open heart surgery to put a new valve in, or a less invasive approach, which is the TAVR procedure, which is the transcatheter aortic valve replacement, where we thread an IV line through the leg and we put a new valve in. So after discussion between the surgeon and myself and the patient, as a team, we decided that the best way of treating this problem would be putting a new valve in via the less invasive approach going through the leg.
Classically, we used to do this operation through the open surgical approach, which does require the patient to get admitted to the hospital and has surgery through a what we call a sternotomy, which is opening the chest, putting the patient on the bypass and replacing the valve surgically. And that will also require, because it's a major operation, the patient will be stay in the ICU for a couple of days, stay in the hospital for up to 5 days on the average, and then it takes them about 2 months to recover and go back to their baseline functioning. This operation cuts all these difficulties, because the TAVR operation allows them to have the operation without any incisions, and usually they recover very well. They're ready to go home the same day or the next day at the most, and they have no pain or discomfort after surgery. So they get relief of their heart condition without the side effects that the surgery can provide.
If we put that into a scale from 1 to 10, I'm a 10 plus. Yes, I feel very good. I could walk, I could run, and do my chores in the house. I'm driving a car, washing the car, even changing the oil on my car. No problem.
If you have symptoms of shortness of breath or chest discomfort, or you feel that your daily activities is more of a burden now and you're getting fatigued doing your daily activities, seek the help of your primary care doctor, who would examine you, and if found to have any murmur, should refer you to a cardiologist for further evaluation. And I am happy to say that at Cook County Hospital and Health Systems, we have the cutting edge technology now to offer all kinds of valve procedures in a less invasive approach to treat this kind of problem.
Just hope that they keep on doing what they're doing, because people like me and many others out there depending on them.